seems that it is back to business, especially we're now seeing with the current traffic that we're experiencing in that particular area and that roundabout there. Thank you very much, Doreen. She will be coming back in not too long to just keep us abreast on what is happening if that situation does ease up. Now, this morning, we're going to be looking at several issues, and one of the issues is what you can do as a corporate or an individual to support government's efforts at encountering COVID-19. Remember, we've been asked that this is our civic duty. Actually, it has bordered to that. So joining me this morning is Dr. Githinji Gitahi, who is the CEO of AMREF Group. So good morning, Dr. Githinji. How are you?
I'm fine, thank you. Good morning, Regina.
Great to have you on board. Maybe you can start off and tell us exactly what does the National Business Compact on COVID-19 entail? Who are the members and what was its objective?
Now, the National Business Compact for coronavirus was something we initiated as soon as Kenya got its first case. We looked at what was going to be successful for this response. We knew there were certain things that the government had put in place, and those things included, the social distancing measures, advice, hand washing. Then there was, at that point, we had not started using masks yet, but there was advice on hand hygiene, cough hygiene, and all those things. And the business sector itself asked, what can we do? So, as the Group CEO for AMREF Health Africa, which is an NGO, we are not really a business. We went to the business sector and we got them together, and we had a meeting together with the UN family, the government represented then by the CES, Massimo Kangi, the UN represented by UN, by SEED and WHO rep, Rudy. And we had people on the table. We had different people, Unilever, we had J&J, we had different people, Swiss Development, MSK, Marketing Society of Kenya was convening the meeting. And we just thought around and said, what really should we do? And we said the first thing we could do was to support Kenyans in ensuring that the measures the government had advised were actually being followed. We knew there was a big gap, for example, in access to water and access to soap for hand washing, which still remain the best interrupter of transmission of coronavirus. So we got soap companies together, Reckitt Benckiser and others, and many of them, and we got them to supply or to donate soap. Then we got other companies that engage with the communities, like Copia, AMREF is one of them. We got others to come on the table that would then, once the soap is donated, there would be organizations that would ensure that hand washing stations are set up across the country. And these hand washing stations would be in places that were identified as hotspots for absence of hand washing, because we know that less than 50% of people regularly wash their hands in Kenya, and yet this is the best tool to avoiding coronavirus. So this is what we did. But at the same time, we say the government is going to have needs. The government, as it responds to a pandemic like this, will have urgent things that may not have been budgeted or may not have been thought about. And the government is like a truck, it doesn't respond to quick things when it needs to. So we established what we call the Flexi Fund. And the Flexi Fund was supposed to be cash money that was going to be available on request by the government when we needed to respond quickly. And we got companies like J&J and Swiss Development Fund to actually put in money there. So this is what we've been doing. And we've done a lot of things, assisting the government to collect waste in the emergency quarantine centers that were set up, assisting the government to buy blankets and bedding when the people needed quarantine and then there was no facilities at that particular point. We have collecting samples from Manyara. We have set up over 2,000 hand washing stations across the country, largely Western Kenya, Nairobi, Mombasa. So this is what the National Business Compact has been up to.
So since when this and we can call it NBC on COVID was launched, how much have you raised so far?
In total, I would say we've raised about close to 70 million, but a lot of that is in kind. So if you look at the cash collections, I think we've raised about 25 million Kenya shillings in cash. That was largely from J&J and the Swiss Development, and then we also got some money from Trigger Foods. The rest of it has been huge amounts of soap that has been donated, time donated, and logistics donated by organizations like Copia that are going to put up this. Hand washing stations that have been put up by Rotary all over the country, as part of the National Business Compact. We have also received tissues, we've received sanitizers, we have received a lot of goods in kind, which we really truly appreciate. And these continue to come through. And of course, time given by people who are working in the secretariat, absolutely for free, Miriam Sidibe and her input, people like Manyara who are working in the secretariat. We have actually a lot of goodwill in this, and we have other organizations like KEPSA and CAM who have been our members as well. But a lot of the corporates have actually come forward with just commodities for us to be able to use and to set up hand washing stations for Kenyans.
So it's not just
and
about
obviously
the
a lot
money.
of media. We have media like yourself supporting us. Without you, we will not be able to go out and tell the public what they need to do. And you've also seen a lot of adverts that we have done. Billboards donated for free. All the billboards you see with the National Business Compact in the city, in Mombasa, wherever, are also for free from our partners. Agencies offering creative work.
So
for free,
what
like,
organizations, Dr. Githinji, are you looking to have on board, to come on board on the National Business Compact on COVID? What organizations are you targeting to come on board so that you can farm up on your interventions in countering COVID-19?
So you see, we are actually not discriminating, because I think, as you have seen, we are receiving both cash. So if an organization feels they are not, capacitated enough to do hand washing, for example, or donate soap. Let's say you're a bank and you don't want to be involved in soap and hand washing stations. You can donate money to the flexible fund, which then helps us to assist the government. You can also donate money that helps us to buy more media space or to engage with the media houses. If you are in manufacturing and you think you can manufacture sanitizers, please come on board, because we need them to distribute to the people. If you are manufacturing soap, which is really necessary, if you are in branding, if you are any organization, including KBC, can join, because you come together, you bring us the platform that you have to reach to the people. So we are quite open, but our focus is to ensure behavior change for hygiene, and to ensure we support the government, and to ensure that we actually not only do behavior change, but we supply the people with the items they need, like clean water and soap for hand washing.
Now, since you're focusing on, issues of hygiene, what is your take on Kenyans' seeming complacency in as far as adhering to the laid down guidelines, especially how we wear our masks, the masks that we are having in the market? What is your take on that, and how is it, countering your efforts?
Well, this is, people keep the habits they know, and it's very difficult to change behavior. Behavior change doesn't happen in a short time. So we know that we've talked about hand washing. For example, I was taught about hand washing when I was in primary school. But even when you're taught that you need to wash your hands before you eat, after you go to the toilet, all these things, we know still that not 100% of people adhere to this behavior change, requests. So, or advice. So we are starting from a place where people were only living with the habits that they know. So when you now introduce a new habit, like wear a mask, people have to get used to it. People have to understand, and also it's not a comfortable thing to do. Wearing a mask, you're not wearing a necklace. It's something that you have to get used to in terms of how to tie it around your face, the initial discomfort. So people have to understand why they wear this mask. So this is what we are doing, advising them on the type of mask, how to use the mask, and also they need to understand that they're doing this to protect themselves and protect their loved ones. So the complacency, what we call complacency, is driven by attitudes and previous behavior. So we do not blame Kenyans. We just continue to advise them. And the thing we need is to talk to them, as we are doing now, continuously, until whatever is they're struggling with becomes a habit.
Mm-hmm. Now, when you talk about hygiene, there comes in the issue of sanitation, and water is a crucial aspect. Availability of water, especially in peri-urban areas, is something that we're still dealing with. How is, availability of water or lack of, especially in Nairobi, which we consider one of the hotspots, affecting your work as a national business compact on COVID?
Well, it is affecting our work. It's affecting the work of the government because we know that access to water is not universal, whereas the need for water is universal. The access to it is not universal. So we have talked to the government, and the government has taken measures to see how to work with the Water and Sanitation Ministry to ensure that water is available. Of course, the challenges continue. So there is a lot of water distribution going on. We know also that there are politicians, and we urge more of them to get water bowsers and supply water to the communities that don't have water, because it is a necessity in stopping this contagion. We beyond that, we are supplying water. We are working to ensure that the tanks that we provide, we are providing now about tanks of 50 liters of water. So we ensure that they are actually supplied with water and they have water in them. So we don't just supply the tanks and the soap, we supply the water as well. But if the government efforts can increase availability of water in the communities, then we do not have them to spend the extra money to supply water where there is none. But it is definitely affecting. But remember, we tell people that running water is not necessarily tap water. Running water, you can actually take water as long as it's clean, or and even it doesn't have to be purified water. It doesn't have to be water from a distillery or something. Water that is fairly clean with soap, just soap, will clean not only coronavirus from your hands, but it will clean other bacteria.
Well, thank you, Dr. Githinji. There, we're having a bit of a problem. They're just trying to get back to that particular conversation. Remember, we're talking about the National Business Compact on COVID, which is, different organizations have come into play to just support government in countering the spread of COVID-19 that has so far claimed 50 lives locally, and we have 963 active, confirmed cases of COVID-19. Now, as we close, Dr. Githinji, there, these interventions by NBC, are they long-term? Are we going to be having this kind of interventions post-COVID?
Yes, we look forward to continuing to building this as a business coalition. Business against poverty. You know that business itself cannot do well unless it does good as well. So we look forward to continuing this. There are many other platforms like SDG platform that's also bringing business, private sector together for healthy populations under the UN platform. And we want to continue with this and also partner with people like the SDG platform, partner with people like Red Cross and others, and all the partners who come together to continue to ensure that people are healthy. So this is not a one-off kind of thing. It is something that we want to make sustainable, through the business fights poverty kind of platform. So it's not a one-off.
Okay. So what areas of scope, how far have your interventions gone as a National Business Compact on COVID? What counties? Are you just based in Nairobi, or is this a countrywide outfit?
This is a countrywide outfit. We have, I think our stations, I would say, have been told, have provided hand washing to more than 1.5 million people. That's a lot. And many of them will be in Nairobi, others in Western Kenya, and others in Coast Province. We have kind of focused on the areas that were originally identified as hotspots. But of course, our measures, including like helping the government to manage waste management, is largely in Nairobi, where the quarantine centers were. Collection of samples is in Manyara. So we are responding to the government needs as they are. But in terms of hand washing, is Nairobi, Western Kenya, and Coast Province.
What's your take from where you sit on government's current measures on stemming COVID-19? We've seen Kenyans, critics coming out and saying, since we have 23 counties that have already had confirmed cases of COVID, then why are you locking in, or rather restricting movement in some areas considered as hotspots? From where you sit, what is your take?
My take is that the government has done good efforts, could do better. Obviously, there is always room for improvement. So I know there's a lot of criticism or even doubt about what the government is doing. But let me just reflect on this. That number one, COVID-19 or coronavirus is new to all of us. So everyone is always a few steps behind the virus. That is the truth. So when you start with what you know. And when the government started, it started with what we knew from other countries. And it started, the closure, for example, of border very early helped us not to import very many cases. Secondly, the closure of movement from urban areas to rural areas has also helped us to keep our elderly people safe. Remember that coronavirus may infect us, but it is most dreadful and most severe in people above 60 years, especially men. So keeping people flowing from the urban centers to rural areas is a problem, is a good thing. The next thing is now what we are seeing with the hotspots. That when you have a hotspot like Isli and Old Town, where you want to contain, that's what we call containment. You find out the positive people where they are, you isolate them where they are, because the virus is carried by people. So mobility of people is what increases transmission. When you slow down movement, you reduce transmission. These are the measures the government is taking, and I think we need to take them seriously.
Mm-hmm. So in your opinion, do we need to put up, given the current curve, we're already having double-digit, infections for the last 1 week. Yeah, we're seeing 50, 47, 46, such numbers. Given where we're going, or rather where the curve seems to be going, do you think we need more stringent measures than what we currently have?
Honestly, I do not think that we need more stringent measures than what we currently have. What I think is we need to comply with the measures that are currently put. So let me just reflect on this, that, the measures beyond what has been done would mean cessation of movement completely, saying people should not move, there should be a lockdown. The challenge with a lockdown is that you don't know when to unlock. It becomes a challenge when you lock down. What signals and when do you say now we have unlocked? Because remember that there's nothing you're going to do that's going to stop the virus completely. What you're going to do is put measures that slows down the rate of infection or the rate of transmission. What we call flattening the curve, that people may not understand, does not mean stopping the virus. It means actually slowing down the virus. So when we put the measures that we're doing now, we're saying if you reduce movement of people, you will then reduce the rate of transmission from one person to another. The only thing that will actually stop the virus is a vaccine. All these measures we are doing will never stop the virus. They will just make sure that the rate of infection is low, that we protect the most vulnerable people, and even if we didn't have a virus, over time, as many of us as probably 6 out of 10 will get infected over time. What you do not want is for all these people, 6 out of 10, to be infected in a short time, and therefore you have a problem because you have a crisis with so many people requiring to go to hospital. That's what we are doing. We are not stopping the virus completely. We are slowing it down. So I think the measures we have, if they can be obeyed, have helped us so far to slow down the virus. We should continue to obey them so that we do not have to lock down the country, because remember, the cure could be worse than the disease, because you can lock down the country and the economic effects or the economic impacts are worse than actually the effect of COVID. So we have to be careful and support the government in the measures that it's taking so that we slow it down.
Mm-hmm. Now, in closing, as you come to a close, Dr. Githinji, you've said that this is an outfit that has a national outlook and is going to be there post-COVID. For an individual and an organization looking to come on board, what do they require?
So we are encouraging individuals, not just the general public, because we know the general public is also affected, and that the general public is the people we're helping. So we are not necessarily asking for the general public to come and put in money, because the general public itself is struggling. So we are cognizant that people are losing their jobs. We are cognizant that people have lost, part of their salaries. So we are asking corporates to actually come to us, and the National Business Compact has a Twitter account, has contact, and you can reach any of us. You can reach myself, you can reach the secretariat. I don't have the email offered, and this can be shared, but we are asking people to contact the National Business Compact. Our contacts are available publicly, and talk to us and we'll tell you exactly what role you can play, because every single corporate, or if you're an individual who has enough resources and you want to participate individually, contact us and we'll be able to guide you. You can even reach me on Twitter. My Twitter account is @Daktari1. You can reach out to me and I'll be able to tell you how you can participate, or even reach the National Business Compact, Business Fights Poverty, #, and we can tell you exactly how to participate.
Oh, very well, Daktari. Thank you for your time there. Your Twitter handle @Daktari1 there on Twitter if you want to reach out and just be a part of this notable and worthy cause there. Later on, we're going to be talking about issues of technology with Nixon Mogeka, who is a data and policy expert. But before